How can we make it whether this is middle meningeal artery or no? You can recognize the middle meningeal artery. This is your middle meningeal artery as it passes between the two roots of the auriculotemporal nerve. It passes between the two roots of the auriculotemporal nerve. Then it enters the skull. Skull के अंदर जाती है via the foramen spinosum. You have three main foramina there. You have the foramen ovale and foramen rotundum and foramen spinosum. ये एक foramen spinosum होता है जो spine के पास होता है. उसके via it will go to the middle cranial fossa. It will enter the skull and will go to the middle cranial fossa. In the middle cranial fossa, it will divide into the large frontal branch जो टीरियन को सप्लाई करेगा एंड स्मॉलर पेराइटल ब्रांच. टीरियन, you know, I have discussed with you what is the terion. It is the area on the weakest area of the skull where you have the edge-shaped suture which is formed between the parietal, frontal, temporal and sphenoid bone. So this was about the middle meningeal artery. Then comes your accessory meningeal. This is your accessory meningeal. You have deep auricular, anterior tympanic, middle meningeal and now the accessory meningeal. The accessory meningeal artery is just near the middle meningeal artery. Middle meningeal artery entered the cranial cavity via the foramen spinosum, but the accessory meningeal artery enters the cranial cavity through the foramen ovale. Okay? It supplies the meninges and the intratemporal fossa. This was about the accessory meningeal. You have one more branch from the first division, that is the inferior alveolar. This is your inferior alveolar. दिस इज़ योर इन्फीरियर. ये सारे ऊपर से थे. ठीक है. योर डीप ऑरिक्यूलर, एंटीरियर टिम्पैनिक, मिडल मेनिंजियल, एक्सेसरी मेनिंजियल, दे वेर फ्रॉम द upper side. Now one branch traverses lower down, that is the inferior alveolar artery. Inferior alveolar artery runs down medial to the ramus. यहाँ पे ramus होता है mandible का यहाँ पे इन्होंने काटा है ramus. ठीक है. ramus के पीछे से है. ठीक है. just medial to the ramus. Then reaches the mandibular foramen. In the ramus you have of the mandible you have a foramina that is called as अंदर से mandible के अंदर से एक foramina that is called as the mandibular foramina. It enters that foramina के बाद you have the canal, that is the mandibular canal, traverses the canal. Then but before entering the canal it gives one more branch, and canal को enter करने से पहले it gives one more branch, that is the lingual branch to the tongue. It gives the lingual branch to the tongue, and it gives the branch to the mylohyoid muscle. यहाँ पे देती है mylohyoid groove में एक branch that is called as the mylohyoid branch to the mylohyoid muscle. Then in the mandibular canal, artery gives branches to the mandible and roots of the teeth. ठीक है. फिर फाइनली इट गिव्स द मेंटल ब्रांच. आगे जाके यहाँ पे मेंटल फोरामेन के थ्रू पास होता है मेंटल ब्रांच टू सप्लाई द चिन. यहाँ पे आगे जाके मेंटल फोरामेन के पास थ्रू पास होती है टू गिव द मेंटल ब्रांच टू सप्लाई द चिन. Again, I will be talking about the inferior alveolar. Inferior alveolar branch goes lower down. It is a branch of the first part of the maxillary artery, but it enters the foramina here, that is called as the mandibular foramina. Before entering the mandibular foramina, it gives the branches, that is the lingual branch to the tongue, and it gives the branch to the mylohyoid muscle here. Then goes via the mandibular canal. Mandibular foramen से तो घुस गई. Then it goes via the mandibular canal, goes forwards, supplies the mandible and the roots of the various teeth. Then passes via the mental foramina to become the mental artery, and it supplies the chin area. So these were the 5 branches of your first part of the maxillary artery. Now if we talk about the second part of the maxillary artery, it has the mesenteric 4 branches: mesenteric, deep temporal, pterygoid, these branches, and the buccal branch. Mesenteric, deep temporal branches, then you have the pterygoid to the pterygoid muscles and the buccal branches. Talking about the mesenteric, this is your mesenteric branch. This is your mesenteric branch. This mesenteric branch, you have the muscle called as the masseter. It supplies the masseter. Then you have the deep temporal. You have the, this is your deep temporal. This is your deep temporal. This was your mesenteric, and this is your deep temporal. These deep temporal arteries, they are divided into anterior and posterior. They ascend on the lateral side of the skull, but they are just beneath your temporalis muscle. If you remember, you have a big fan shaped muscle here that is called as the temporalis muscle. These temporal arteries are present just beneath your temporalis muscle. Then you have the branches to the pterygoid muscles. Then you have the branches to the pterygoid muscles. These are your pterygoid branches. These are your pterygoid branches. These supply your pterygoid muscles. They are your lateral and the medial pterygoid. They supply your lateral and the medial pterygoid muscle. Then you have the buccal branch. Then you have the, this is your buccal branch supplying the skin of the cheek. Buccal branch supplying the skin of the cheek. I will again enumerate the branches of the second part. Firstly, you have the your mesenteric branch supplying the mesenteric muscle. Then you have your pterygoid branches supplying the pterygoid muscles. You have the deep temporal branches just going beneath the temporalis muscle. Then you have the buccal branch which supplies the skin of the cheek. After that comes the branches of the third part. The branches of the third part, as I have told you, from the first part there arises the 5 branches. From the second part you have the 4 branches, and from the third part you have the 6 branches. Those 6 branches are posterior superior alveolar artery, infraorbital artery, greater palatine artery, pharyngeal branch, artery of the pterygoid canal, and the sphenopalatine artery. Posterior superior alveolar artery. If we talk about the posterior superior alveolar artery, this is your posterior superior alveolar artery. This is your posterior superior alveolar artery. Posterior superior alveolar artery. What does this artery do? इट एंटर्स द टेरिगोमैक्सिलरी फिशर. यहाँ पे मैंने आपको दिखाया था ना वो फिशर जैसा एक प्रीवियस पिक में. इट एंटर्स द टेरिगोमैक्सिलरी फिशर. फाइन. देन इट मूव्स ऑन द पोस्टीरियर सरफेस ऑफ द मैक्सिला. यहाँ पे जो बोन होती है मैक्सिला उसके पोस्टीरियर सरफेस पे इट मूव्स एंड एंटर्स द वेरियस कैनाल्स टू सप्लाई द मोलर एंड द प्रीमोलर टीथ. It supplies the molar and the premolar teeth. Again I will tell you, this is your posterior superior alveolar branch from the third part of the maxillary artery. It goes downwards and it is posterior to the maxilla. It supplies your molar and the premolar teeth here, and even the maxillary air sinus. Then comes your, this is your infraorbital branch. This branch is your infraorbital branch. Infraorbital branch. This infraorbital branch, it enters from the maxillary artery. Before the maxillary, जब maxillary artery घुसती है ना टेरिगोमैक्सिलरी फिशर में, टेरिगोमैक्सिलरी फिशर में जाने से पहले it gives 2 branches, that is the posterior superior alveolar which you have discussed and the infraorbital artery. I am telling you that before entering the pterygomaxillary fissure, the maxillary artery gives 2 branches, that is this posterior superior alveolar and infraorbital. Now this infraorbital branch, it enters the orbit. Definitely if it is infraorbital, it has to enter the orbit through the inferior orbital fissure. You have a fissure, it goes through the inferior orbital fissure first, then moves via the infraorbital groove, then infraorbital canal to emerge on the face via the infraorbital foramen. ये है आपकी इंफीरियर ऑर्बिटल नर्व. ये इंफीरियर ऑर्बिटल नर्व कैसे जाती है? आँख ऑर्बिट के थ्रू ट्रेवर्स करके पहले ये जाएगी. इट विल गो विया इंफीरियर ऑर्बिटल फिशर. यू हैव अ फिशर हियर दैट इज कॉल्ड एज द इंफीरियर ऑर्बिटल फिशर. देन इट गोज विया द इंफ्राऑर्बिटल ग्रूव. यहाँ पे इंफ्राऑर्बिटल ग्रूव होता है. फिर ग्रूव के आगे यू हैव अ कैनाल एंड फाइनली कैन यू सी दिस फोरामेन, इंफ्राऑर्बिटल फोरामेन के थ्रू ये बाहर आ जाती है. So this was the course of the infraorbital artery. This infraorbital artery, it gives various branches. It gives middle superior alveolar, and anterior superior alveolar. And they will also supply the teeth, incisor canine and premolar. Your infraorbital gives two branches, middle superior alveolar and anterior superior alveolar, supplying the teeth. Also it gives a branch when it appears on the face पे जब ये जाती है via infraorbital foramen, it supplies your lacrimal sac और nose को भी ये supply करती है. Then the other branches of the third part are given within the pterygopalatine fossa. Pterygopalatine fissure, before the entrance into the pterygopalatine fissure, it gives two branches, that is the posterior superior alveolar and infraorbital. And within the pterygopalatine fossa, it gives four more branches, that is the greater palatine artery. वो आपको यहाँ पे evident नहीं होंगे because they are within the palatine fossa, and pharyngeal branch, artery of the pterygoid canal and sphenopalatine artery. अब अगर हम बात करेंगे greater palatine artery की, it enters the ये जो greater palatine artery होती है ना, you have something in the mouth structure that is called as the hard palate, ऊपर से टंग के ऊपर, ठीक है, जो roof of the mouth बनाता है, that is called your palate. Your greater palatine artery, it passes, you have a canal in the palate that is called as the greater palatine canal, ठीक है. Then it runs forward, lateral margin of palate से चलेगी, ठीक है, जाएगी incisive canal में to enter the nasal cavity, ठीक है. वैसे ही होती है आपकी लेसर पैलेटाइन आर्टरी, वो पैलेट पे होता है, लेसर पैलेटाइन फोरामिना उन्हीं के थ्रू पास होती है एंड विल सप्लाई द सॉफ्ट योर पैलेट, ठीक है. अगेन आई विल रिपीट द ग्रेटर पैलेटाइन आर्टरी, फॉर इंस्टेंस दिस इज योर माउथ, फाइन. Palate forms the superiorly the roof of the mouth. So your greater palatine artery within moves like this in the greater palatine canal, and it supplies the some branches enter the nasal cavity while it reaches the incisive canal here and supplies it, right? Similarly, you have lesser palatine artery that again emerge on the palate and through the lesser palatine foramina supplies the soft palate, okay? Similarly, you have the pharyngeal branch. Pharyngeal branch, it supplies the part of the nasopharynx, auditory tube and the sphenoidal air sinus. Then you have the artery of the pterygoid canal. Artery इसमें होता है skull में एक canal that is called as the pterygoid canal. This artery passes via this pterygoid canal and supplies pharynx, auditory tube and the tympanic cavity. Then you have the sphenopalatine artery. It passes via the foramina of the same name, sphenopalatine foramina, और nose को supply करती है. It is one of the major sources of blood supply to the nose. After that comes your pterygoid plexus of veins. Can you see this? This is the pterygoid plexus of veins. ये veins का एक plexus होता है, ठीक है. ये कहाँ पे होता है? It is either यहाँ पे होता है आपका कौन सा lateral pterygoid muscle. It is either around the lateral pterygoid muscle or within the and even within the lateral pterygoid muscle, ठीक है. Its tributaries are as according to the branches of the maxillary artery. The tributaries of the plexus correspond to the branches of the maxillary artery. This plexus is being drained by the maxillary vein, ठीक है. ये plexus drain होगा into the maxillary vein. This maxillary vein then unites with the superficial temporal vein and to form the retromandibular vein, ठीक है. यहाँ से ये आपका plexus होगा, pterygoid plexus. It will drain into the maxillary artery which will join the superficial temporal vein and they will form your retromandibular vein. The plexus, this plexus communicates with the inferior orbital vein through, यहाँ से inferior orbital vein के साथ ये करेगा communicate. It will even communicate with the cavernous sinus and with the facial vein. Inferior orbital vein के साथ communicate करेगा, cavernous sinus के साथ communicate करेगा and the facial vein. Thank you.